Okay, so one more thing I wanted to talk about too, about the skin prep and shaving and things like that. In regards to the 3-inch tape that you can use to pick up all the hair and go back and forth with it like a little seesaw over the surgical site and everywhere to get all the hair pieces. That 3-inch tape is great to retract back um, certain areas of the patient's body that, may be a little bit pendulous and, like pendulous breasts or a very large pannus when you're doing a cesarean. You can take this 3-inch tape and tape it to the patient and lift up on things and then tape it to underneath the surgical table. So everything's up and out of the way. You'll see that done a lot. It's very helpful. So if you can find rolls of tape, they're like your best friend in the operating room. In regards to skin prep too, I always like to have all my stuff when I'm preparing the operating room in between before the patient is wheeled back and after I've seen him. I like to put all my stuff in one of those little ringed stands that surgical tech was talking about in his video. There's usually like a little bowl tray thing that you can put in that ring stand, and I always put all my prep, my Foley catheter, my gloves, everything I'm going to need, to get that patient ready. I always throw it in there, and then I can wheel it right over to the table and be ready to go like that. So that's just a little tip of mine. So key players. So we have our surgeon, of course. We need he or she or they in the operating room. You also have you as a PA. Sometimes in different places now, they may not have PAs. They have RN first assists. So they act as a first assist. They've gone through some training and some school in order to do that. So they may be in there first assisting instead of a PA. You also have your anesthesia. So you can have a anesthesiologist who is a physician who practices and specializes in anesthesia. You can have a certified nurse anesthetist or a PA anesthetist. So PA ones they're kind of rare and far and few between, but I've heard of a couple. I haven't actually seen one in practice at the places I've worked, but they do exist. It's just they're rare. They're rare to come by. So also you have your surgical technician, aka scrub tech. That's the guy who was in the last video that we saw and welcoming you to the operating room. They are amazing. They know tons of stuff about surgical instruments. They could, probably assist in a lot of cases. They do sometimes if there's no PA around and the surgeon needs them. They know what the surgeon needs, the exact time that they need it, when to hand it to them. They're just absolutely amazing people, and they work very, very hard. So they usually come in and set up, their surgical trays, instruments, and everything before the surgery starts. So, and again, all the stuff that they work with is blue, green, and shiny. So be careful when you go in there and you don't touch their things, because they'll get really upset if you touch and break their sterile field of all the things that they just opened for the procedure, because you may not have another pack and things like that, and they may need to autoclave it all over again. It pushes everything back, and that's not okay. So you also have the OR nurse, also the circulating nurse known as. They're wonderful. Please get to know them. Sometimes they can be a little difficult at first, but you can win them over, and they're awesome. They know a ton, and they're so helpful. Your fellows. So these are surgeons that have already graduated medical school. They've been out for a while, and now they just want to specialize even more in something. So at UCSF, we had a bariatric surgeon, a general surgeon who wanted to specialize in bariatrics. So we came into this fellowship for a year at UCSF. He was awesome, super great. And we had one every year rotate through. You have your residents. So sometimes they're a little scary, especially when they're first out. And you just kind of have to watch them. And as an already PA, as a student, you're kind of going to be, along the same lines as a medical student and resident. So, but you can learn a lot from them as well as a student. You can pick their brains. They're awesome. And then students, of course, if you have medical students in the operating room, you have you as a physician assistant student, you have CRNA, surgical tech students, and nursing students. So always learn from each other. Always try and pick each other's brains, work as a team. So teamwork, we'll look at this picture here. So At the head of the bed, you have anesthesia, okay? The ones sitting down, you'll see them reading books a lot or looking at their phone. And then the scrub tech, sorry, I have this lovely little notice that loves to keep popping up here. You have your scrub tech at the foot of the bed. See that big tray? Your scrub tech usually stands to the left foot of the patient. So the one with the blue cap on there. And they're ready to pass off their meds. They have usually that big Mayo stand there, and they also have a big tray. So anything that they need right away, ready to grab, they have it on that big Mayo stand. And then on their big table to the side, they have their other things that they can grab. Your surgeon is either on the right or the left side with the student, on the ipsilateral side or opposite side mirroring them, commonly closest to the large surgical tray table that is above the patient's feet, right? So I always stood, if you see the light green cap, that's where I always was, although we didn't have all these extra people in between, you know, me and the surgeon and the scrub tech. Usually it was, my surgeon is, you know, to the right of the patient, which would, if you're looking at this, you're looking to your left, right? And then the fellow would be on this to the right of your right, okay, but the patient's left. And the fellow would be on the outside working as well. That's if you're in a teaching hospital. It may be a little bit different or set up differently. Your circulating nurse usually is at a small portable wheeling desk with a computer so they can chart throughout the procedure, or they're running around getting surgical supplies, injectables, instruments, things like that. And again, if you look at the screens here, the screens on the left or the screen behind the anesthesiologist, they're in a spot where everybody can see them. Hopefully you can see them as a PA, because sometimes you can't. You want to kind of, you know, look around to make sure you can see it if you're doing laparoscopic surgeries. They're placed where you can see them before the surgeon even starts. The lights have these special little green covers that go over them so you can grab them during surgery and keep everything sterile. Just make sure you don't touch anything else on the light. So let's move on to the next thing. So scrubbing in. I have a video of this. I think it's awesome. Again, it's that surgical tech. He's great. Everybody's different in how they scrub. Definitely pick the scrub tech's brains if you can, or your surgeon's brain or another PA, and ask them how to scrub. Usually do your first scrub at the beginning of the day, and then you can start scrubbing in with a different little, it's almost like a soap dispenser, but it has surgical scrub in it. So you'll see what I'm talking about in this next video here. So here we go.
Today's video, we are going back to the basics again. We're going to be talking about your scrub. Your 5-minute scrub, your morning scrub, whatever you want to call it. In school, you know, they tell you 5 minutes, it takes you 5 minutes, or it takes you, 10 strokes on each plane. It changes a little bit out in the real world. But the base of it is there, and you do need to learn how to properly do your first scrub of the day. If you're going to be using Avogard or whatever type of other sterile substance you use on your hands, you always have to have that first scrub of the day with a brush, picking out under your nails, all that stuff. So let's go over this. First, we got the scrub sink. Scrub sinks may be a little different depending on your hospital. It may be like you hit it with your knee and it'll turn on. Ours here, we have motion, just motion detected. So pretty much I just have to have one hand and kind of swap it over with the other. But let's go through this. So there's plenty of different scrub brushes that you can use. This one here, this is what I like to use. It's a chlorhexidine scrub. They also have iodine scrubs and a couple other ones, but this is the one I like to use as it does not irritate my skin at all, and it works. So you find what works. So I'll start off with tearing the package. We'll open up this package, throw it away. Take our little plastic tool here. This is going to be used to go underneath our nails. Get the sponge wet. Get your arms wet. Make sure not to touch anything. We're not touching anything. So under the water, we're going to be going underneath our nails. I don't really have nails, so I can't really do it, but you'll be going underneath your nails each time, over through all your nails, blah, 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 blah. Throw it in the trash can. Next, we're going to be doing our sponge. So wet the sponge, get it nice and foamy. Nice and foamy, nice and foamy. And we'll start with your fingertips first. Fingertips are always first. The object of washing your hands is working from the fingertips all the way to your elbows. Both sides. I'm going to be going over to your thumb. Now, when you look at your thumb, think of each finger as a box, and you're going to be doing 10 strokes on each side of the box. So we got 10 strokes here, 10 strokes here, 10 strokes here, 10 strokes here. And you're going to be doing that for every single finger. Every single finger. As soon as you're done with your fingers, inside palm in circular motions, another 10 times. Back of the hand, another 10 times. Now I'm finished with this hand, so I'll pass the brush over and we'll start working on the other fingers. Palm and the back of the hand. As soon as you're done with the back of the hand, now both hands are done. So now we'll start moving over the wrist and halfway up the arm. Again, same thing. Think of your arm in 4 planes, as a square or as a rectangle. So 10 strokes in each plane. I'm not going all the way to the elbow. I'm only going halfway up the arm. Now transfer over. We're going to do the other arm. Now, we are up the forearm, and we'll continue on through down to our elbow. Same thing, 4 planes. Think of your arm as a rectangle or a square, and continue doing 10 strokes in each plane. This entire arm and hand is done. Transfer over. Finish up the rest of the other arm down to the elbow. Both arms are done. Drop your sponge. Get your water. Now it's important when you start the water, you get the soap off of your hands and you go one way. Don't go back and forth and back and forth and back and forth. You're going one way. So take it slow. I'm not touching anything. I took it nice and slow, one smooth motion. Now let's do the other side. Arms are up. Let them drip in the sink. You can't wait here all day. So now it's time to go on into your room. Problems that you might have. You're in the middle, say you're in the middle of brushing. If you lose control of the sponge, let it drop. Oh, you drop the sponge. Are you done? No, you are not done. You wash your hands, you get a towel, grab another sponge, and you got to start over. I'm sorry, it's got to happen. Surgical conscience, that's where it comes into play. Start over, do it again. First scrub's out of the way. First case of the day is out of the way. You're ready to start your second case. Do you use a scrub? Do you use a scrub sponge again? Sure, you can use a scrub sponge. Not a big deal. If that's your preference, you can do that every single time you scrub in. But there's also the choice of a scrub solution. For us, we have Avogard. It's a great antiseptic solution, and you can use it throughout the day multiple times. It has like a moisturizer built into it and stuff, so you're not cracking up your hands and skin. Similar kind of scrub technique where you take a couple squirts, maybe. There we go. You take a couple squirts. Yes, I know this is gross. The joke never gets old. And again, we start with our fingertips. We bring our fingertips in. Fingertips in. Go around all of our hands, all of our fingers. And it's always the hands first. Always the hands first. We never come back to the hands. As soon as we go down to the elbows, never come back to the hands. As soon as the hands are nice and good in between the fingers, taking it down each arm. Down each arm, down to the elbow. Each arm, down to the elbow. And that's it. You're good. You're ready to go into your room. You're ready to gown, glove, and start your next case. Thanks for watching, guys. I hope this basic hand washing video helps out some people. And as always, see you in the next video.
All right, so next video is how to gown and glove. Same guy, he's awesome, I love him. He's going to be showing you as a scrub tech how to gown and glove somebody else, but it's nice to see in case you need to help somebody as well as a student or as a PA, because you may need to do that quickly. You need to help your surgeon, possibly if somebody else is busy doing something, or somebody can't help you gown and glove yourself. You need to know how to do it, because a lot of times we may make students struggle a little bit. It's mean, I know, but we may be doing other things and not being able to help you. So you need to know how to do it on your own in a sterile way and not jeopardize the sterile field, okay? So go ahead and take a look here. Play it.
This video is going to consist of sterile gloving and gowning 3 ways. We've got our open glove technique, we've got our closed glove technique, and gloving and gowning the surgeon. Stay tuned. Welcome back to another Surgical Tech Tips video. Fortunate event again, we had another canceled case, surprisingly. Usually it doesn't happen this often, but I'm glad for it. At least I can use the setup. So first thing you notice with this setup is that I have all of my gowns right there. They're all sterile. They're all sterile on the field. I'm not scrubbed in currently, and most likely you won't be either after you set up your case. Sometimes there's time in between. You may be waiting for a surgeon or whatever the case is. Sometimes you may not be scrubbed in. So in the event that you're not and you're scrubbing back in to start this case, try your hardest to open up a separate gown somewhere else. You can open it, if the patient's not in the room yet, maybe you can open it up on the bed. You can open it up on top of a trash can, an extra mayo stand, a prep stand, something or somewhere else somewhere else that's not going to be your sterile field. If your hands are wet, if you do a wet scrub every single time, you don't want to be dripping any water or anything onto your sterile field that you've just created and spent a lot of time working on. If your room is too small and you may not have enough room to do, to put a gown somewhere, then yes, you can take a gown off of there. I would really try not to. A lot of people do. I'm guilty of it myself sometimes if I'm in a hurry, but you should really try and not do that as much as you can. Arms are up always. Grab your towel first, open it up. Stay on one side, fingers, and all the way out to the elbow. The left side of the towel, fingers, and all the way out to the elbow. Get rid of it. Now the gown. You notice we have cuffs here. So we're going to take the back of the gown, put our hands in the cuff, open it up, and arms go in. Your hands never come out of these cuffs. Never come out. Now, some people may have already opened up a pair of gloves on top of their gown, and that's okay. You can absolutely do that. And in fact, I think they tell you to do that in school. I personally don't like doing it that way, and my reason being for that is that this is a very small sterile field, and when you're opening up a pair of gloves, it's very easy to contaminate the pair of gloves that you open up on top of your gown. Especially if the gloves are sitting up on top of your gown. You go to pick up your gown, and the gloves fall off, they get contaminated, and then what do you do? So personally, I like to gown off of the field, but glove on the field. The reason being is that my hands and arms are wet from the scrub. So once I put this gown on, my arms and hands are technically protected. Yes, there's still an opening at the end of the cuff, but I'm not dripping all over my sterile field. That's the way I do it. It may or may not be the right way. I know for a fact that in school they had us open up our glove and gown in this little tiny square. In real life, though, I just find it a lot easier and safer to glove myself on the sterile field. So let's take it over there. All right, so we got our gloves on the sterile field. Remember, hands are inside the cuffs. We're going to open up our gloves. Just like that. We're going to take the first glove. First glove is going to be the right glove. They're indicated right and left. We're going to take the first glove, and what I like to do is because these are latex or plastic, whatever they're made out of. They're always a little sticky. So I like to hold the cuff of the glove and pull on the fingers a little bit to kind of loosen them up. So we're going to take the glove from the cuff and flip it over. With your left hand, you grab the outside cuff. With your right hand, the inside cuff, and you're just flipping it over your cuff, the cuff of your gown. That's all it is. Flipping it over the cuff of your gown. Now that that's on, you kind of pull the cuff down, or pull the cuff of the glove down a little bit, and then pull the gown sleeve itself. Now be careful with pulling on the gown sleeve too hard, because these can tear pretty easily, and I've had them tear before. So now let's do the left hand. Now this glove is technically sterile. So again, I'm grabbing the cuff of the glove, pulling on the fingers to loosen that glove up. Flipping it, so my words, my numbers, and everything are down facing my palm. Holding the cuff of the glove with my right hand and the cuff of the glove with my left, and flipping it over. Pull that glove down a little bit, pull on the gown, and we're in. That is a proper closed glove technique. And that is the way that you should be doing it every time you scrub into your room. The next technique is going to be open glove technique. And really the only time as a tech that you should be using open glove technique is, maybe if you need to assist the nurse with putting the Foley in or something like that, maybe she needs a little help, you can open glove then. Still considered sterile, but it's just an open glove technique. Putting dressings on central line at the end of the case, maybe putting a tegaderm over the central line or femoral line or something like that. Those are the only times you really are going to be open gloving. You should not be doing an open glove technique when you're scrubbing into your room. It should always be a closed glove technique. So let's go over this. Obviously, with open glove technique, I'm not gowned because the only thing that's going to be sterile are my hands. So let's open this up. Careful not to touch any of the glove and completely open up the package. Now again, we're starting with our right glove, and we're going to take the right glove, and technically, everything on the outside bottom half of this glove is considered the inside of my glove. So it's the inside cuff. So I'm grasping onto the cuff of the glove and inserting my hand in the glove. Let go. Do not touch this cuff anymore because it's no longer sterile. The only thing that's sterile are your palms and fingers. So with your palms and fingers, take your fingers over the fingers of the glove and your thumb on the cuff, kind of pull a little bit to loosen up that glove. You slide your fingers underneath the cuff, try and open it up a little bit, and your fingers slide in. Again, let it go. Palms and fingers are the only sterile thing right now. That is open glove technique. Third technique is gowning the surgeon. Surgeon's coming in, their hands are wet, their arms are wet. Just as you used your towel to dry your hands and arms off, start with the far left side, as if you're dry. Yeah, go ahead, dry your hands.
Okay, so just quickly, this will be you on the left. You're coming in, you've opened the door with your butt instead of your hands. Sometimes there's like the little door handle, it pushes down so you can try and bring your butt cheek up there and open the door up. If you're short like me, it's a little bit harder. You're gonna have to try and figure it out. So you come in, you have your arms up in front of you, not touching anything, and you stand there and you wait for the scrub tech to come to you, okay? It may be a little bit, you may be standing there kind of air drying for a minute while everybody's trying to run around and prep the patient and do everything else. So this will be you on the other side on the left, and the scrub tech is going to be putting things on you. So kind of focus on how he's having his hands and what he's doing, the guy on the left, okay? And how he's grabbing the gloves to put them on and things like that.
Now, the technique I taught you about putting your hands in the cuffs is for gowning yourself. Now think the exact opposite when you're gowning somebody else, a surgeon, an assistant. Cuffs are on the outside. You're holding the inside tabs and pulling the gown down. The gown opens up, folds up, and you fold your hands underneath the cuffs. Nurse will take care of the back. They'll do the Velcro, they'll do the tying, get all that taken care of.
Okay, this is something that you can do to help the scrub tech or anybody else who's scrubbing in, the surgeon. You can go behind them and go ahead and tie them up. Do the Velcro to the back behind their neck. Make sure you're not choking them out. And then you can tie the strings together. It's kind of like a robe in the back. There's one kind of inside and one on the outside on the left. Make sure you do not touch the sterile part. You can only touch the inside of the gown. I like to go up behind somebody when I'm going to do this and place my hand in between their shoulder blades on their back so they know I'm there. So they don't spin around and all of a sudden now they're not sterile, okay? That's just some little tips. Okay.
Surgeon's hands are up. You bring their cuffs down, just over their fingers. And again, we're starting with the right glove first. Holding the hands, or holding the fingers, pulling it taut to loosen up the glove. Open it all the way up. folding the cuff underneath my fingers to open up the glove for easy insertion. Same thing on the left.
Okay, so sorry I'm pausing this so many times, but when you're inserting your hand in, you definitely want to make sure you've towel dried everything off before you put your gloves on and your gown and things like that, because otherwise your hands are going to stick and you're not going to be able to get your hand down in the glove. And if you're really pushing really deep with your hand trying to scoop it down in the glove, that poor scrub tech's going to have to kind of like go down the glove with you, and they really don't like that. It hurts their hands or fingers or arms, so just be gentle when you put your hand into the glove, okay? And what you do is you grab kind of the cuff of the glove to pull on to your hand with your sterile glove that you've already put on, okay?
And that is gowning and gloving a surgeon or assistant. All right, that is it. We went through all 3 techniques. I hope you guys enjoyed the video. I know some of you are enjoying these basic videos, so I'm going to continue making them because they're fairly easy to make. I don't have to get a lot of people in here and try and organize something. I do have a big video like that, but it's just kind of hard.
Okay, we'll move on to the next slide here. So choosing your gloves, it's really personal preference. There are a lot of different types of gloves. They come in nitrile, vinyl synthetic, latex, latex-free, powder-free, with powder, all different types. This is something you're going to have to learn and see what you like. You're going to have to learn and see what the fit of your glove is. However, now we have 2 sets of surgical gloves that everybody uses usually in surgery. Some old school surgeons only like to have 1 glove on, and it allows them to feel a little bit better and just know what they're feeling for, because if you have 2 layers of gloves, it may be a little bit more difficult. But generally, you will be putting on 2 pairs of gloves. So the first one you put on is a biogel indicator underglove. So if you have a perforation in your glove, a finger stick, a cut in it, you put it on, stretch it too tight, and now there's a little hole in it, it will increase the detection of those types of things. It will bleed a color. So it can be green or blue. These gloves are green or blue underneath. Some people like to wear a smaller size versus a larger size compared to their over glove, their regular surgical glove that goes over the top. You're going to have to figure it out. I used to do that, and then I just like the same size glove. Make sure you don't pick gloves that are too tight, because about 20-30 minutes in the procedure, your hands are going to be squeezed, your wrist is going to be tight, and with the gown underneath, it's going to hurt at the end of the surgery. Your fingers are going to go numb or really sweaty, so you're going to have to play with it. But definitely don't get something way too tight where you're going to be uncomfortable the whole procedure, okay? These are awesome. Just make sure you ask the scrub tech or the circulating nurse to help you figure out your glove size and what type of glove that maybe they like. You can ask the scrub tech because they wear them all day long. So they have particular ones that they like. Okay.